Joining me now is Dr. Kevin H. Small, a plastic surgeon at CHS's Mercy Medical Center and St. Francis Hospital, the Heart Center. He is also the director of plastic surgery for the New York Bariatric Group. Welcome, and thank you so much for joining us.
Thank you for having me today.
So we've been talking, of course, about the surgical procedure itself, the bariatric surgery, to help people shed all of this excess weight. But once they're done with that, you come into the picture, and why is that?
So the plastic surgery component is really completing the weight loss journey. So patients have lost the weight, but they have a reminder of their history of being overweight for quite some time, and those changes in their body now, the excess skin is a reminder of what their body has gone through, and a plastic surgeon can help with their patients feeling as good as they look, and with making those skin changes on their body after weight loss.
So somebody's lost up to, what, 100 pounds, and they got a lot of extra skin. So what do you do?
So really, to contour a full body takes a year.
A year?
It can really be a year, because you really can't do a full body contouring at one time. That's just too much surgery and too much OR and anesthesia for a patient. So I like to span it out between 4 surgeries to really contour a body. The first step would be contouring the waist, which is a circumferential lower body lift. So it's an incision going all the way around the patient's waist.
Wait, the incision goes all the way around?
360 degrees around to tighten the belly, tighten the flanks, those love handles that patients may have persistently after weight loss, and improving the contour of the buttocks. So that would be the first procedure, and then typically we wait 3 months after that. We can contour the chest and the arms at a second procedure. 3 months after that would be contouring the lower extremities, the thighs, and then the fourth procedure would be contouring any facial changes that may happen after weight loss.
And each one of these procedures, especially the first that you described, sounds like a pretty extensive surgery.
Right. So lower body lift, that incision going 360 degrees around, is about a 4 or 5 hour procedure. The patients stay overnight in the hospital, but it's really restoring their waistline, removing that overhanging skin that they can have circumferentially around their waist.
Now, I'm just curious, because we were talking earlier in the program about how they can go back and they start this life that it's got a lot of lifestyle changes, they exercise, etc. But what you're describing means you can't really exercise.
Right. The most important thing is that they're at their goal weight before proceeding with any of these procedures, because the most important thing is their overall health, and so we want to make sure that they're healthy going into the surgical procedure. When we do the body contouring, there are 6 weeks of not being able to go to the gym for their post-operative recovery, but then after that, they're able to start getting stronger, continuing with their nutrition and their exercise, and sometimes it's not 3 months between the procedures, sometimes it's a little bit longer, whatever. We're working around the patient's goals and their and what they want to be contoured.
I would just want to make sure I understand this. So when they have the surgery, it's usually about 3 months later that they've lost all of the weight?
So once they've had the surgery, whether it's a gastric sleeve or a laparoscopic gastric band, we want the patients to lose the weight and for that weight to be stable before doing the body contouring. That process takes about a year from their gastric sleeve or any other bariatric procedure before plastic surgical intervention.
So now you've described that you've taken this 360-degree, there's a scar. And I'm assuming there'd be scars on the arms and the legs, I mean, whatever. I'm sure not every patient has to have all of that done.
Right.
But what do you do about those scars?
There is the chance for scarring with any type of surgical procedure. You know, the most important thing is that it's a team approach, that there's always things that we can do to improve the scar. The most important thing is actually sun protection. So the sun can cause a permanent suntan in a scar. So we encourage sun therapy and sunblock while the patient is healing. There's different injections or creams or laser therapy that we offer at New York Bariatric Group to kind of maximize the healing during the process.
Gee, I'm just thinking, here's a woman who's had this surgery and now she's got this amazing new body, and you're probably telling her not to put a bikini on.
Well, she can put the bikini on, she just has to have some suntan lotion on underneath.
Right. There's another procedure that you do that a lot of people are interested in, which is called CoolSculpting. Do you use that for these patients in place of some of the stomach contouring?
So CoolSculpting is really a fine-tuning device, and for those people that don't know what CoolSculpting is, CoolSculpting provides freezing temperatures to the fat underneath the skin, freezing those fat cells so the body can metabolize them and excrete those fat cells. CoolSculpting is a device, though, for fine-tuning results after body contouring. So the first step would be removing that excess skin, and if patients have persistent areas of focal fat, then it would be a great result to narrow the waist a little bit more, or the inner or outer thigh, or even the arm. So it's a good adjunct after the skin has been tightened.
Now, I know a lot of women who do not have obesity problems, but what they do have is middle-age spread, and they're doing this CoolSculpting.
Right.
Is that something that works for those people?
It's a great device for those types of patients. For those patients that are very compliant with diet and exercise, that they have just focal areas of fat deposits, but their overlying skin is very elastic and still taut and haven't gone through a lot of cyclical changes. And so that would be great to freeze those fat cells in those areas and help with narrowing the waist.
And then that will, the skin will then shrink?
It will, because they have good skin tone and good elasticity, because their body hasn't really gone through those cyclical changes that a weight loss patient has.
Did you do it anyplace else, like on the arms or?
So we have lots of different applicators for the CoolSculpting device. It can go anywhere from a large debulking device for
Wait, large what?
It's called a debulking head, and it's really for a large fat area on the belly. And we have even the smallest device that goes underneath the chin for those patients that have persistent fat underneath the chin, but they have good skin tone. So for addressing those little fat deposits underneath the chin.
Boy, you got a little bit of everything going on. This sounds almost like a little kind of a miracle thing for, in many ways, for people who've had bariatric surgery and for others.
Right. We're very lucky to be able to offer this service to the patients. They've had so many changes in their life with having bariatric surgery and having the weight loss, and we want to be able to make them feel like themselves again. And with doing those skin changes, they really feel fantastic. And sometimes this is even an insurance-based procedure for contouring the patients, because the skin can be so excessive that it limits their mobility. It can cause pain in some of their joints because it's hanging down so low. It can cause rashes underneath the skin. So it sometimes can be an insurance-based procedure because this excess skin can be limiting.
It sounds, though, that like once this is done, they really look and feel marvelous.
Right.
Probably better than they have in a very long time.
Because with the weight changes, their health overall is just better. These are patients that used to be on diabetes medication, no longer taking medication. Their blood pressure is back to normal. And now that they're able to contour their body because they're feeling so good, they really just feel and look fantastic.
I love that. We're going to take a quick break. Stick around, though, because our discussion will continue right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. We are discussing bariatric surgery, and back with us again is Dr. Kevin H. Small, a plastic surgeon from CHS's Mercy Medical Center and St. Francis Hospital, the Heart Center. He's also the director of plastic surgery for the New York Bariatric Group. So we've been talking about, I find this absolutely fascinating, but is there some people that go through this bariatric surgery who are not eligible for the plastic surgery that you do?
Right. So that's a great question, because one of the reasons we wait a year before doing the plastic surgical contouring is we want to make sure that the patients are weight stable, that they haven't relapsed into gaining the weight again. So that's why it's so important to be a part of a center of excellence for your weight loss journey. So you have the nutritionist, the physical therapist, the bariatric surgeon, the plastic surgeon, everyone providing a team approach for their weight loss. And so we want to make sure that their weight has been stable, because if you're going through a lot of changes and fluctuating in your weight, that can impact your healing and your long-term results.
If it's going to bounce around like that, how do you know how much skin to remove, et cetera, et cetera?
Right, and our skin is elastic. So
Yeah.
if we do all of this contouring and if they gain weight again, they will gain weight in that area, and that skin will get stretched out again. So it's an important part of the journey to make sure that they are stable for the next stages.
After the surgery, what's the recovery process like? Because you said 4 surgeries over the course of a year.
So patients typically need to stay in the hospital overnight. Depending on the surgical area, they may have drains underneath the skin to prevent any fluid from building up under the skin during the healing process. They have a compression garment on to contour.
Like Spanx?
Like surgical Spanx, to keep everything tight during the healing process. They need to wear that for 6 weeks while the body is molding to your frame underneath. No cardiovascular exercise for 3 weeks after the procedure, no running, jumping, or spinning. But after that, they can start slowly to get back in the gym, and then they're back at full duty at 6 weeks.
I know you talked about taking excess skin, from like underneath the jowls and that sort of thing. But people who are obese, who haven't seen, the realities of aging in the face for a long time, what happens to the face? Do you work on that too?
With the changes in your weight and during the weight loss journey, your face can go through some facial changes and actually look thinner and longer. And sometimes during the surgical contouring and the plastic surgical journey with facial aesthetics, we actually have to restore fat back to the face.
You're putting fat back in the face.
We're putting fat back into the face because we want patients to have that fuller cheeks and to have that more oval-shaped, more youthful face. There are other areas where sometimes we have to transfer fat. For example, the buttocks. After they've lost the weight, their buttocks may be flattened, and so with doing the body lift, we sometimes transfer fat from other areas to the buttocks to improve gluteal contour.
Wow, it sounds like in a certain sense, you're really remaking the person.
Absolutely. They've had these fantastic changes with their body and their health, so we're remolding them to feel good for their next stages in life.
And what do they say to you? I'm just curious about when somebody walks through the door. The surgery, all of the surgery is done, they're completely recovered, they walk in the door. What do they say?
Well, not only are they extremely excited for their aesthetic changes that they have a waist. They've still gone down in clothes sizes because their waistband has narrowed. But they just feel overall better. They're not lugging around that excess skin. They're not using creams for the rashes that they have on their body. So it's not only fixing their aesthetic concerns, but really affecting their everyday life.
And they've got to have a completely different reaction when they go out in public, when they take the subway, or they ride the train, or they go to the grocery store, or they see people that have never probably witnessed them like this.
Because with the weight loss, they unfortunately can be embarrassed by some of that excess skin, because that excess skin is sometimes challenging to hide in their clothes. And now they can wear form-fitting clothes. They've lost the weight, they feel fantastic, and now they can look fantastic.
So it's truly, truly life-changing.
Absolutely.
That must be so rewarding to see that when it comes in.
It's a great team to be a part of, and that we're all working together to help patients reach their weight loss goals.
Thank you to our guests today, Dr. Kevin Small and Dr. Punkti Patel, for sharing such important information about bariatrics. And as always, for more information or to schedule an appointment at one of Catholic Health Services' 6 outstanding hospitals, you can call 1-855-CHS-4500 or visit chsli.org. Thank you so much for joining us. I'm Jane Hansen, wishing you goodbye and good health.